As you can see, the buildup of LDL plaque significantly restricts flow, but through targeted treatment, we can reverse.
What if your cholesterol has been slowly clogging your arteries for years without you feeling a thing? High cholesterol is often called a silent condition because most people don't notice any symptoms until serious complications develop. But in some cases, your body may show warning signs that deserve attention. Today, we'll reveal 10 possible signs associated with high cholesterol and explain why regular cholesterol testing could help protect your heart. Stay until the end, because our number one sign surprises almost everyone. Let's begin. Introduction. Every second of every day, your blood carries nutrients throughout your body. One of those substances is cholesterol. Despite its bad reputation, cholesterol isn't your enemy. In fact, your body needs cholesterol to build healthy cells, produce hormones, and make vitamin D. The problem begins when there's too much LDL cholesterol, often called bad cholesterol. Over time, excess LDL cholesterol can build up inside the walls of your arteries, forming deposits known as plaque. As plaque builds up, arteries become narrower and less flexible. This can reduce blood flow and increase the risk of heart attack, stroke, and other cardiovascular diseases. The challenging part is that high cholesterol usually causes no symptoms. That's why routine blood tests are so important. Still, in some cases, your body may show warning signs related to cholesterol buildup or its complications. Let's begin our countdown. 10. Chest pain during physical activity. Do you notice chest discomfort while walking uphill, climbing stairs, or exercising? This symptom is known as angina. Angina happens when the heart muscle doesn't receive enough oxygen-rich blood. One possible reason is narrowed coronary arteries caused by plaque buildup over many years. People often describe angina as pressure, tightness, squeezing, burning, heaviness. The discomfort may also spread to your neck, jaw, shoulders, back, or arms. However, chest pain has many possible causes. Heartburn, muscle strain, lung conditions, and anxiety can all produce similar sensations. If you experience sudden or severe chest pain, especially with shortness of breath, nausea, sweating, or pain spreading to your arm or jaw, seek emergency medical attention immediately. Never ignore persistent chest discomfort. Your heart could be asking for help. 9. Yellowish deposits around the eyes, xanthelasma. Have you ever noticed small yellow patches near the corners of your eyelids? These soft, slightly raised deposits are called xanthelasma. They're made up of cholesterol-rich material that collects beneath the skin. Not everyone with xanthelasma has high cholesterol. Likewise, many people with high cholesterol never develop these deposits. However, xanthelasma can sometimes be a sign that cholesterol levels should be checked. The patches themselves are usually painless and harmless. Some people choose to have them removed for cosmetic reasons, but they may return if the underlying cholesterol problem isn't addressed. If you notice yellowish patches around your eyes, it's worth discussing them with your healthcare provider. A simple blood test can help determine whether your cholesterol levels are within a healthy range. 8. Leg pain while walking. Do your legs begin to ache after walking a short distance, but feel better when you stop and rest? This symptom is known as intermittent claudication. It can happen when narrowed arteries reduce blood flow to the muscles in your legs. One possible cause is peripheral artery disease, a condition often linked to plaque buildup in the arteries. People commonly describe the discomfort as cramping, tightness, burning, fatigue in the calves or thighs. The pain often improves within a few minutes of resting. Many people mistakenly assume it's simply part of getting older. But persistent leg pain during walking deserves medical evaluation. Regular physical activity, avoiding smoking, maintaining a healthy weight, and managing cholesterol are all important steps in supporting healthy circulation. 7. High cholesterol found during a routine blood test. Here's something that surprises many people. Millions discover they have high cholesterol completely by accident. They feel perfectly healthy. No pain, no dizziness, no warning signs. Then, during a yearly physical, workplace screening, or routine checkup, a blood test reveals that their LDL cholesterol is much higher than expected. That's because cholesterol itself usually doesn't cause symptoms. The only reliable way to know your cholesterol level is through a lipid panel blood test. This test measures total cholesterol, LDL bad cholesterol, HDL good cholesterol, triglycerides. Even if you feel healthy, regular cholesterol screening is one of the simplest ways to identify potential problems before they become serious. Early detection gives you the opportunity to make lifestyle changes or receive treatment if necessary, before complications develop. 6. Yellowish skin lumps xanthomas. Our number 6 sign is something you may actually be able to see. Some people develop small, yellow, or orange-colored lumps under the skin called xanthomas. Unlike the flat yellow patches around the eyes that we discussed earlier, xanthomas are raised deposits of cholesterol that can appear on different parts of the body, including elbows, knees, hands, feet, Achilles tendons, buttocks. These growths are usually painless. They often develop gradually and may go unnoticed for months. While xanthomas are uncommon, they can sometimes be associated with very high cholesterol levels, particularly in people with inherited cholesterol disorders such as familial hypercholesterolemia. Fortunately, treating the underlying cholesterol problem may help prevent new deposits from forming. If you notice unusual yellow lumps beneath your skin, don't panic. Many skin conditions can look similar. However, it's worth scheduling an appointment with your healthcare provider for an evaluation. Sometimes your skin can provide valuable clues about what's happening inside your body. 5. Family history of high cholesterol. Our number 5 warning sign isn't something you feel. It's something you know about your family. If one or both of your parents, brothers, sisters, or close relatives have high cholesterol or developed heart disease at a relatively young age, your own risk may also be higher. One inherited condition called familial hypercholesterolemia, or FH, causes very high LDL cholesterol from birth. People with FH often appear completely healthy, yet cholesterol begins building inside their arteries much earlier than normal. Without diagnosis and treatment, this condition greatly increases the risk of premature heart disease. The encouraging news is that early detection can make a significant difference. If high cholesterol runs in your family, talk to your healthcare provider about when you should begin cholesterol screening. Knowing your family history doesn't mean you'll definitely develop high cholesterol. But it does mean you should be especially proactive about healthy habits and regular checkups. Knowledge is one of the best tools for protecting your heart. 4. Erectile dysfunction. This next sign is often overlooked, but it can sometimes provide an early clue about cardiovascular health. For some men, erectile dysfunction or difficulty achieving or maintaining an erection may be linked to problems with blood flow. Healthy erections depend on healthy blood vessels. If arteries throughout the body begin narrowing because of plaque buildup, blood flow can be reduced, not only to the heart, but also to other organs. It's important to understand that erectile dysfunction has many possible causes, including diabetes, stress and anxiety, depression, certain medications, hormonal changes, smoking, excess alcohol use. High cholesterol is just one possible contributing factor. Rather than feeling embarrassed, consider persistent erectile dysfunction as a reason to speak with a healthcare professional. Addressing cardiovascular risk factors early may benefit both your heart health and your overall well-being. Remember, your body is interconnected. Sometimes one symptom can point toward a broader health issue that deserves attention. 3. Stroke or mini-stroke warning symptoms. Our number 3 sign is one that should never be ignored. Over many years, high LDL cholesterol can contribute to plaque buildup inside the arteries that supply blood to the brain. If one of these arteries becomes severely narrowed or blocked, it may lead to a stroke or a transient ischemic attack (TIA), often called a mini-stroke. Common warning signs include sudden weakness or numbness on one side of the body, difficulty speaking or understanding speech, sudden confusion, loss of balance or coordination, sudden vision problems in one or both eyes, a severe headache with no obvious cause. These symptoms usually appear suddenly. Never wait to see if they improve on their own. A stroke is a medical emergency, and fast treatment can greatly improve outcomes. Remember, high cholesterol doesn't directly cause these symptoms overnight. Instead, it may contribute to the gradual narrowing of arteries over many years. Knowing your cholesterol levels and managing them when necessary is one important step in reducing long-term cardiovascular risk. 2. Heart attack symptoms. Our second warning sign is another medical emergency. When cholesterol plaque builds inside the coronary arteries, it can reduce blood flow to the heart. If a plaque suddenly ruptures and forms a blood clot, blood flow may become blocked, causing a heart attack. Common warning signs include pressure, tightness, or pain in the center of the chest, pain spreading to the left arm, shoulder, neck, jaw, or back, shortness of breath, cold sweating, nausea or vomiting, unusual fatigue, lightheadedness or dizziness. It's important to know that heart attack symptoms can be different for different people. Some women, older adults, and people with diabetes may experience milder or less typical symptoms, such as unusual fatigue, nausea, or shortness of breath without severe chest pain. If you think you or someone else may be having a heart attack, call your local emergency services immediately. Every minute matters. Quick treatment can save heart muscle and save lives. 1. No symptoms at all. Our number one sign is also the reason high cholesterol is so dangerous. Most people experience absolutely no symptoms, no pain, no dizziness, no warning, no feeling that anything is wrong. Meanwhile, excess LDL cholesterol may slowly build inside the arteries for years, or even decades. This silent process may continue until a serious complication develops, such as heart attack, stroke, peripheral artery disease. That's why healthcare professionals don't rely on symptoms to diagnose high cholesterol. Instead, they recommend regular cholesterol screening using a simple blood test known as a lipid panel. This test measures total cholesterol, LDL bad cholesterol, HDL good cholesterol, triglycerides. If your cholesterol levels are higher than recommended, your healthcare provider can help you develop a plan that may include lifestyle changes, medication, or both, depending on your overall risk. The earlier high cholesterol is identified, the more opportunities you have to protect your heart before complications develop. How to help support healthy cholesterol? The good news is that healthy daily habits can make a meaningful difference. Here are a few science-based strategies that support healthy cholesterol levels and overall heart health. Eat more vegetables, fruits, whole grains, beans, and legumes. Choose healthy fats from foods such as olive oil, nuts, seeds, and fatty fish. Limit foods high in saturated fats and avoid trans fats whenever possible. Stay physically active for at least 150 minutes of moderate exercise each week, or as recommended by your healthcare provider. Maintain a healthy body weight. Avoid smoking and exposure to secondhand smoke. Limit alcohol if you drink. Get enough quality sleep and manage stress in healthy ways. Have your cholesterol checked as recommended, especially if you have a family history of heart disease or high cholesterol. Small lifestyle changes, practiced consistently, can have a lasting impact on your cardiovascular health. Final thoughts. High cholesterol is often called a silent condition because it usually develops without noticeable symptoms. Today's possible warning signs included chest pain during activity, yellow deposits around the eyes, leg pain while walking, high cholesterol discovered during a routine blood test, yellowish skin lumps, family history of high cholesterol, erectile dysfunction, stroke warning symptoms, heart attack symptoms, and most importantly, no symptoms at all. Remember, having one of these signs does not necessarily mean you have high cholesterol. Many of them can have other causes,